got a little something in my coffee today. It is New Year's. It's only about noon, but might as well. It's the end of 2020. I feel like everyone deserves a little bit of a drink. So this video is going to be posted on the first Sunday of 2021, the new year, which is insane. I just can't wrap my head around it, but today is New Year's Eve. So I just wanted to say Happy New Year's. I hope you guys are setting some great goals for the year 2021. I hope it goes better than 2020, and I'm excited for the new year. It's a fresh start, and it feels like even more of a fresh start this year for some reason. I just feel like I'm ready to make some bigger changes in my life, and I know that sounds really corny, like I'm making like resolutions, but I don't know, I feel different about it this year. I feel like my head's in the right space. I'm gonna make a vision board, which I'm really excited about. I've never made one of those before, but we'll see how that goes, and maybe I can keep you guys posted on this channel about reaching my goals and setbacks and accomplishments and all that stuff. So what are you guys doing for New Year's? Are you guys setting some New Year's resolutions or some goals for 2021? Do you guys not believe in that stuff? I know it sounds kind of corny, but I don't know, I'm gonna give it an honest try this year. I'm feeling good about 2021. Anyway, welcome to my channel. If you're new here, my name is Nikki and I'm a new grad labor and delivery nurse. I started this channel to share my journey with you guys and share some of the things that I've learned along the way. So if you're interested in that, I would really appreciate a subscription to my channel. Is that what it's called? It sounds weird. I would appreciate it if you subscribe to my channel, and if you like this video, go ahead and hit that thumbs up button. It really helps with the YouTube algorithm. It helps me to grow my channel, which is one of my goals for 2021. So if you guys want to help me out, I would greatly appreciate that. Anyway, this video today is going to be about some of the things that I didn't realize labor and delivery nursing was, and some of the things that I realized after I started working as a labor and delivery nurse, and some of the things that aren't so glamorous and so fun about labor and delivery. I still love my job and I'm so thankful to be where I am, but I think like any job, it has its ups and downs, and I'm just here to share some of those things with you guys today so you can make an informed decision if this is really where you want to be, and to give you guys more of an insight on what really goes into being a labor and delivery nurse. So if you guys are interested in that, let's get started. The first thing that I realized when I started orientation was that there is so much to do. I feel like during clinicals and when I rotated through labor and delivery at the beginning of my nurse residency program, you're just there and you just hope to see some births, and you hope to watch like a mom deliver vaginally, watch a C-section, and at least I was in such awe of like the whole process that I wasn't really paying as much attention to what the nurses were doing, what the responsibility of the labor and delivery nurse really was. I was just so caught up in watching, you know, the miracle of birth, and I wasn't really paying attention to all of the tasks and all of the responsibilities that were up to the labor and delivery nurse. So once I started orientation and once, you know, that responsibility started to fall on me, I realized it was so much to do. First of all, there is so much documentation. Baseline documentation is every 30 minutes. You have to document on the contractions and the fetal heart rate. A half hour goes by like that when you're busy, so that can really add up and really pile up against you if you're not on top of it. On top of that, you have to document everything that happens to the patient. You have to document when they get an epidural, when you call the provider if you have a concern about the fetal heart rate, when you put in a Foley, how much they void, if they threw up, if they're requesting pain medication, if you educated them on their pain management options. There's just so much to document, and it's really a big part of your responsibility and takes up a good chunk of your time. The other thing is that there is just so much to do during a delivery, and the only way to learn is to do it during a delivery. Like, there's no way to slow down the pace of a baby coming out, and it makes it difficult to learn. I sometimes get frustrated with myself because like I'll have one delivery where I feel like I'm remembering everything and I'm getting everything right, and then the next day or even the next delivery that same day, I feel like I drop the ball and I get flustered and frustrated and lost and overwhelmed, and I missed all of these things that I did the other day, but I didn't do it now, and it just gets overwhelming and a little bit frustrating. But you just have to realize that it's a fast-paced environment. Labor and delivery really does go from 0 to 100 like this. Like, I had a patient on Tuesday, so 2 days ago, my last shift, that was 3 to 4 centimeters. She came in that morning at 5 a.m. I came onto my shift at 7 in the morning. We went in the room at like like 7:30. She was fine. She was super uncomfortable, begging for an epidural, and we got her an epidural. And then of course my preceptor had like a meeting that she had to go to at like 8:30. So she was like, okay, the charge nurse is gonna look after you. Like everyone's around, they know that I'm gone. Like they'll look after you. They'll make sure that you're okay. And then I'm in there like talking to the patient, documenting on the computer that's in the room, and the provider comes in and she says, okay, like I'm gonna check your cervix, see how much progress you've made. The patient at this point is completely comfortable, feels nothing with her contractions because of the epidural. The doctor checks her cervix and she goes to me, you're not gonna believe it, she's fully dilated and +3 station, which means the baby is really low and ready to come out pretty much. And I said, what? Like I'm by myself, like I don't have my preceptor. I called my charge nurse on our phone and I said, hey, like we're about to start pushing in so-and-so's room. And it was just insane. It was just like, you just get thrown into these situations and you just have to go with the flow, and you just have to try to learn as you go and not get frustrated with yourself. It's really easy to get frustrated with yourself, and I've been battling that a little bit, but you just have to trust yourself, trust the process, and rely on your support, your nurses and other staff to support you and to guide you and to help you. And it can be, like I said, overwhelming, stressful, frustrating, all of the above, and it just is what it is. It comes with the job and it comes with learning how to be a labor and delivery nurse. And then the other thing about maternity nursing in general, whether you're in labor and delivery or mother baby, I don't know about your school, but my school barely touched on maternity nursing. Like they just threw in what we needed to know for the NCLEX and that's it. And it doesn't help that I was in an accelerated nursing program, which was only 12 months long. So I think we had maybe a couple weeks of maternity nursing classes, and I only had 3 days of maternity clinicals. So I know that's probably because of my accelerated program, but I just feel like I was not prepared. I have learned so much on the job in the last like 9 weeks that I've been here, and it just comes with it. No matter how good you were in school, you're not going to be prepared for labor delivery nursing. It is what it is, and you just kind of have to accept that and be comfortable with being uncomfortable for a while. The second thing that you might not have realized about labor and delivery nursing is that it's not always this like beautiful process. You're not always helping this family that's just so excited to welcome a new baby into their family. First of all, there's always fetal demises, and that's a really sad experience to have. I haven't had to deal with that yet just because I'm still towards the beginning of my orientation. That's definitely something that I'm gonna have to be trained on, and something that I'm gonna have to learn how to rein in my emotions, because it's not about me at that point. It's about me helping this family deal with their loss, and I'm gonna have to learn how to put my own feelings on the back burner and do what I can to help them get through it. But besides fetal demises, there are just other situations that aren't what you typically envision when you're thinking of helping a woman deliver. We had this one patient that was unfortunately addicted to drugs. Pregnancy was the result of sexual assault, and she unfortunately was still using throughout the entire pregnancy, to the point where she didn't realize she was pregnant, didn't get any care for the pregnancy. She was found on the street and in labor. She came in by ambulance, and we had to take care of her. She ended up getting an epidural, and she didn't understand that she could not get out of the bed with the epidural, that her legs, just wouldn't support her, and that she would be a fall risk. So I had to sit in the room with her for most of the day to make sure that she wasn't getting out of bed, because we walked in there at one point in the day and she was standing next to the bed with an epidural catheter in and a Foley catheter in, which was on the opposite side of the bed. So she was almost yanking all of these catheters out of her body. She was hallucinating because she was withdrawing. We had to figure out how to get her an order for methadone, and it was just this whole situation, and it was just such a stressful patient, and we had to deliver this baby. You got to do what you got to do, and you have to provide care for any pregnant woman. It's not always this happy family that's excited to have a baby. It could be a lot of different varieties of sad stories and people that don't want their babies. It could be hard and it could be frustrating, and it's just not always what you want it to be. And then stepping away from like the really heavy stuff, there's just lots of examples of patients being controlling or having unrealistic expectations. I had a patient with like crazy control issues that had to like control everything, that had her own ideas of how the labor should be, that was like kind of going against our policies. Like for example, she wanted to delay cord clamping for 3 minutes where our policy is 1 minute, and she was kind of arguing with the doctor with the placenta still in her body, baby on her chest. She's like, no, don't cut it for 3 minutes. I want 3 minutes. And the doctor was trying to explain what the risks were with delaying cord clamping for that long and why we don't do that. But she was just adamant on the 3 minutes. So the same patient wanted her partner to catch the baby, which also doesn't really go with our policy. I've never personally caught a baby, but I can't imagine doing it. They're so slippery. There's so much fluid coming out of there. I just do not want to be in charge of catching that baby and making sure it doesn't fall. And then also there's just patients that unfortunately don't have a great labor process. We have a lot of inductions coming in because of preeclampsia, gestational hypertension, gestational diabetes, post-dates. There's just lots of inductions coming in these days because of numerous health concerns. And these inductions, I've seen inductions take 4 days. Like, can you imagine sitting in a hospital bed for 4 days? You're in pain because we're trying to force contractions to force your body to give birth. And it's just like all of these situations ranging from fetal demises to just uncomfortable and not ideal labor processes. You have to realize that most of the time it is like a happy couple expecting the birth of their beautiful baby and everything goes well, but there are times where things go wrong. You end up having a code CB, so you have to rush to the OR and get the baby out. And unfortunately, like in that moment, our attention is on the mother and the baby and getting the baby out. And what ends up happening is the partner is told to stay in the room until we can get the mom to the OR, get everything situated, and then we go back and get the partner. So that can also be a stressful time and also not an ideal situation. Moral of the story here, I feel like I've been rambling. It's just not always this beautiful process that you envision it to be, and you're not always going to be able to give every patient the experience that they want and the experience that you want to give them. And then the third thing that you might not know about labor and delivery nursing is that it is a lifelong learning experience. You are never going to know everything. There's always updates to policies, updates to recommendations from AWHONN and other organizations, and you're just never gonna be to the point where you know everything. And I think that kind of goes with most nursing specialties, actually probably all nursing specialties. It's always going to be something to keep up on, and I think it's important in labor and delivery to kind of continue your education and not to ever like fall into a lull, and to keep discovering what helps your patients out and what the best practices are, and to continue your curiosity. And I think that's the best way to provide the best quality of care that you possibly can to your patients. And then the other thing is just keeping up with your certifications and your license. That kind of comes with any specialty of nursing too. With labor and delivery, you have your fetal heart monitoring certification, your NRP, and then like your hospital-based learning. We use Cornerstone, and we have Cornerstone modules that we have to complete. They can be a little bit tedious as well, but there's just always things to do and things to keep up on in labor and delivery. And it's just another thing that comes with the job, just like all of the other things that I have told you guys about today. And then the last thing that really isn't so fun about labor and delivery is just that it's such a litigious specialty, which means that it has the highest rates of lawsuits. And a lot of people, when something goes wrong, they want someone to blame, especially when it's something that happens with their child or something that happens during their process. People want someone to blame, and it's just a risky specialty to get into because of that. You always have to think about covering your own butt and making sure that you're documenting everything that happens. You're covering your butt. You're documenting that you provided education. You're documenting that the patient verbalizes understanding of that education, which is really important verbiage to use that I've learned through my orientation. And anything that you forget, if you didn't document it, it didn't happen. And there's only one way to really know what happened. In 20 years, you're not gonna remember what you did or didn't do. So the only way to cover your butt and to tell the story of what happened is to make sure that your documentation is on point, that you're writing everything that happened, everything that you did and didn't do. I don't mean to scare scare you, but it's just something to keep in the back of your mind and to work into your practice to make sure that you're documenting accurately and correctly and timely and making sure that you're covering your own butt. I'm not gonna lie, I've heard this so many times from my coworkers. It does kind of worry me and it does kind of scare me, but I'm just gonna focus on providing great care and making sure that my great care is documented so that if I ever do get called into court, everything that I did is gonna be right there and that I'm following policy and that I didn't do anything wrong. Overall, the most important thing to make sure in labor and delivery is to follow policies and evidence-based practice and document that you followed the policies and evidence-based practice. If you do that, you should be fine and there's nothing to worry about, although I already feel like there's this like dark cloud like looming over me, but Jaxie, there's no one there. Jaxie's trying to scare away the lawyers that are gonna be coming after me in 20 years. It can be a source of stress and sometimes it does like creep into the back of my mind, like, did I do that? Did I document that? Did I do that correctly? You know, but I'm still learning, I'm still orienting. So I'm just trying to form good habits so that I make sure to document everything and to cover my butt. What I've learned in life is that there's no point in stressing about something that didn't happen, because if you worry nothing's gonna change, you're just wasting your own energy and wasting your own health and well-being worrying about something that might or might not happen and that you have no control over. At the end of the day, all you can do is control your own actions and whatever happens, happens, and there's not really any point in stressing about it. I'm done with my coffee and now we're done with the video. So I hope you guys learned something about labor and delivery nursing in this video. I hope that I brought some insight. I hope it didn't cause any stress or worry or for you to change your mind. It's nothing crazy. It's just some of these small things that you might not realize or might not think of when you're thinking of labor and delivery nursing. And it comes with any job, nursing or otherwise. So I just wanted to give you guys a clearer picture on some of the things that I deal with as a labor delivery nurse. I hope you guys found this video enjoyable and entertaining and informative. That's the word I'm looking for. And if you did, I would appreciate it if you hit the thumbs up button and subscribe to my channel. Like I mentioned before, it's really beneficial to me to help me to grow my channel, which is one of my goals in 2021. Let me know what some of your goals are in 2021. Drop them down in the comments. I would love to hear them and hear what plans and what actions you're going to take to reach those goals. I feel like 2021 is going to be a great year and I think it's going to be everything I wanted in 2020 and some, and I just hope that is the case for me and for all of you guys out there. Thanks for watching. I really appreciate it and I'll see you guys next week in 2021. All right, bye.